You have a baby under 3 months old. This is why pediatricians want you to check a temperature rectally. Rectal temperatures are recommended in babies under 3 months old because it's the most accurate way that we can estimate a baby's core body temperature. We consider a fever 100.4 degrees or 38 degrees Celsius. Younger infants are at a higher risk of serious bacterial infections like meningitis, urine infections, and infections that can go through the bloodstream. Because of this, it's really important to catch them as early as possible, and fever may be the only sign that an infant gives us that there's something wrong. Doctors follow specific protocols for babies who have a fever, particularly under 3 months old, and depending on how they look and exactly how old they are, that may involve needing to do more invasive types of tests like getting blood work, using a catheter to get urine samples, and even potentially getting spinal fluid through a lumbar puncture. So we don't want to miss a baby who has a true fever and really needs to be evaluated in that way, but we also don't want to do this to a child who has an inaccurate temperature and didn't need that in the first place. The other ways that we check the temperature, whether that be in the ear, under the arm, in the mouth, forehead, they just have a wider margin of error. For an older baby or child who otherwise has a healthy immune system, typically having a snapshot can help us enough to figure out what to do next versus we need very specific information in those little infants. My name is Dr. Heather. I'm a board-certified pediatrician and founder of Peds Parent Network. Follow for more kids' health information.